Winter blues is something that is very common in the United States. In fact, between 10 and 20% of Americans do experience some degree of winter blues. There is a condition called seasonal affective disorder, also known as SAD, that is a more significant type of depression. In fact, it is a clinical form of depression. And then lastly, interestingly, when the weather gets gloomy and it gets darker earlier, our body clock, our circadian rhythm, kicks in and releases melatonin, which makes us sleepy and lethargic. And that sometimes will be signs and symptoms of SAD. So the hallmark of signs and symptoms of seasonal affective disorder would include things like sadness, lethargy, tiredness, fatigue, a lack of desire to participate in those activities that people typically enjoy. It can also result in things like weight gain and increased sleep as well. The research shows that the most effective treatment is cognitive behavior therapy, a type of counseling that helps a person learn to cope and manage with the symptoms. It has been found to have the lowest relapse rate, so it works very effectively. Often used in combination with cognitive behavior therapy is phototherapy or light therapy that helps mimic what we miss when we don't have the sunlight. So it's been very effective as well. In some cases, your doctor might want to prescribe an antidepressant that increases that serotonin level we talked about earlier, called a selective serotonin reuptake inhibitor, an SSRI. And then also vitamin D. We talked about how vitamin D decreases serotonin. A doctor can look at your vitamin D level, and if you are low, they can very easily provide a supplement that sometimes can help a person feel better. The last thing that I really want to push is exercise. Now, when a person is in the throes of a depression, exercise is not the first thing that comes to a person's mind. But once we start the treatment with things like CBT or medication or light therapy or vitamin D, that sometimes will help get that person to a point to where they can then start to delve into some mild exercise, work themselves into an exercise program, because that serves the same purpose. Exercise increases serotonin levels, it decreases something called cortisol, which is our stress hormones, and also can help with some of the brain fog and the mental focus loss that we get oftentimes with seasonal affective disorder.